in cancer patients, diagnostic testing is the whole axis of which diagnosis is made. So a lot of times it tells you where the primary tumor is. It tells you how far the cancer is spread, to what extent it is spread, whether it's made it into the lymph nodes. And it tells you the places that it hasn't gone. It tells you the places that are free of disease. And all of these have to be taken into consideration when you determine what method and means you're going to do to treat the cancer. Before any type of decision can be made as far as treatment, you have to do staging. And the invention of digital mammography has improved resolution with mammograms. It's made them much more easier to get across country to other facilities. Before you had to check out films and haul them and bring them back, and now they can be put on a disc and simply mailed. So digital mammography is a must. The other thing that all breast cancer patients need to demand of their physician before they ever go for a lumpectomy is an MRI of the breast. Multiple multi-center studies have been performed which have shown that oftentimes patients who had breast cancer before the invention of MRI would have recurrence or develop a tumor in the contralateral breast some years later. And what we're finding now is that those malignancies were there, they just weren't seen. But now with MRI, we're able to find these what we call occult tumors, tumors which aren't otherwise seen, and we can address those at the same time as the primary lesion. So without a doubt, any patient who's been diagnosed with breast cancer needs to require of their physician that an MRI of the breast is ordered and performed at an appropriate facility, even prior to surgical decision making.